Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Mannitol. Mannitol is actually freely filtered carbohydrates. This is freely filtered in the glomerulus and it enters the uh, tubules. It is not metabolized. It is not a sulfonilamide because it is not a sulfonamide. So it has not much allergic reactions are seen in uh, mannitol. So, mechanism of action of mannitol. Mannitol mainly acts on the thin descending limb of loop of Henle. It acts on thin descending segment of loop of Henle. And earlier it is believed to be earlier it is believed that it acts on proximal convoluted tubule, but actually in reality it acts on thick thin no not thick it acts on thin descending segment of loop of Henle, and it will expand the extracellular fluid. Now, pharmacokinetics. Loop diuretics are not absorbed, not loop diuretics. Osmotic diuretics are not absorbed orally. They are not metabolized. The half-life of the mannitol is around 1 hour, and it is a laxative. So, because it is a laxative, it can cause diarrhea. Then, uses of mannitol. Mannitol can be used in acute narrow angle glaucoma. So mannitol is used in acute narrow angle glaucoma. It is used in conditions of oliguric renal failure. It is used. It is also used in brain edema. Then contraindications of mannitol. Mannitol is contraindicated in conditions of cerebral hemorrhage or acute tubular necrosis. It is contraindicated. Mannitol is also contraindicated in case of pulmonary edema with left ventricular failure. In these conditions, it is contraindicated because in acute tubular necrosis the filtration of mannitol may be affected because of the tubule damage. In pulmonary edema and left ventricular failure it is not indicated, and in intracerebral hemorrhage also it is contraindicated. Then side effects of mannitol. Side effects of mannitol is mannitol causes loss of water preferentially, so it most commonly causes hypovolemia because there is huge loss of water without the loss of sodium. So sodium in the blood increases, resulting in hypernatremia, and even the potassium in the blood increases, leading to hyperkalemia. It does not cause inhibition of transport of any ion. It does not cause inhibition of transport of any other ion, and thus it will mainly increase only the free water clearance. Free water clearance is the water that is lost. That is the only clear water which is lost without any solutes. So here this mannitol will helps in increasing the free water clearance especially. So this is because this mannitol is an osmotic diuretic. It is actually used, or actually it is the drug of choice in brain edema. In brain edema, mannitol is the drug of choice. Mannitol can also be given in conditions of asplatin induced nephrotoxicity. We can use this. Mannitol can be used. Then.
thank you and thank you for watching.